So friends, on behalf of Myri Tadler Foundation, we extend you to a very hearty welcome to this exciting and very relevant topic for all of us, and that's about diabetes. Many of us, if not all of us, are having this particular problem, maybe for years together, maybe for a few years. But this is a very important topic for any health conscious person to know about. And to speak on this particular topic, we have a very eminent personality with us. We have with us Dr. Mahesh Padsalge. He is an MBBS and MD from University of Mumbai. He has done his fellowship in the diabetes management from CMC Vellore. He has got a diploma from endocrinology from the Southwell University, UK. He is also MRCP UK endocrinology.
Okay.
He has got a diabetes clinic.
I'll see that. Okay.
He has got a diabetes clinic at the Seawood, Navi Mumbai. He has a good number of publications in the national and the international journals, and he's also working as an associate professor in the Dubai Patel University. So on behalf of all of us, we welcome Dr. Mahesh and request him to kindly take over the floor. Dr. Mahesh, the floor is open to you, sir.
Yes, sir. Good evening, all. So the language will be English. That's fine, no, sir?
Yes, sir. Yes, sir. Please.
Yes. Okay. So everyone can understand English well. So we'll have a.
But DY Patel man should invite Kurchon.
Yes, sir.
DY Patel.
Yes. So good evening, all. This is, as sir said, I am Dr. Mahesh Padsalge. I work for diabetes and endocrinology. That is thyroid, PCOD, obesity, and many more diseases. So today, for next 30 to 40 minutes, I'll talk about different facets about diabetes management. So how we should look towards diabetes management in nutshell. And there are a lot of other facets which probably people think it is because of diabetes. It is not because of diabetes. And if many of you are probably 50% of you may be diabetic actually, as per my knowledge. And so we will see like how your say journey which is going through diabetes management over the period of time. So I'll just start with what is diabetes basically. So diabetes is nothing but slightly higher sugar than normal population, like say. So everyone is having glucose in his body, which we call blood glucose, and blood glucose is very necessary for our brain, because brain does not continues to work except the blood glucose. So blood glucose is necessary, but whenever it becomes high glucose, then we call it as diabetes. So we should understand what is mean by normal diabetic, normal blood sugar values or normal blood glucose. So you are having 3 boxes in front of you. So the first box is for normal person, like the fasting blood sugar less than 100, then after food blood sugar less than 140. So if you are having this much amount of blood sugar, then it is labeled you are non-diabetic. And on extreme right side of your slide, you are seeing diabetic patients, like whose we call diabetic, as that is fasting blood glucose more than 126, after food blood glucose more than 200. And there is third test, which I have not written on the slide, but which is called as HbA1c, that is 3 months average blood sugar, that is 6.5 and more than that. These population are called basically diabetic. And in between, like normal and diabetic, there is a subset of patients which has a significant chunk of population in India. We almost are having 7 to 8 crores of diabetic population in India, and at the same time we are having 7 to 8 crores of pre-diabetic. So pre-diabetic patients and diabetics almost are same. Only in pre-diabetic we don't treat with the medicines and insulin. We treat diabetic patients with the medicines and insulin. But the side effect which basically diabetic patient gets, the similar side effect actually are prone for pre-diabetic populations are also, as like say considered to be diabetic patients are more prone to get heart attacks 4 times than normal population. Similarly, pre-diabetic patients are more prone to get heart attack by four times. So there are some types of diabetes we should understand. Number 1 type is type 1 diabetes. It is generally is present in the children's less than 25-30 years of age. Here, 100% of pancreas is absolutely not working, and it has to be treated only with insulin, and that is called as insulin-dependent diabetes mellitus. And type 2 diabetes, basically it is very common. We almost have 95% of type 2 diabetes patients in 100 total diabetic patients. They are all basically more than 40 years of age. They generally have significant family history, and they are not insulin dependent initially because the part of pancreas which produces insulin is basically working. So I'm going to tell you how much pancreas actually is destroyed at the time of diagnosis. Third type of diagnosis is called as gestational diabetes mellitus, which is called as pregnancy associated diabetes mellitus. We are seeing now premarital weight of a lady, normal lady. When you married, the people who are listening to me, females, their weight was 40 kg at the time of marriage, 40 to 45. Now, if you consider the premarital weight of the lady now, it is 60 to 65. So many of the girls nowadays, they are obese, and all obese girls are actually prone to get this gestational diabetes mellitus. So basically, pregnancy is the state of hyper insulin resistance or diabetes prone hormones, which are placental lactogen hormones, progesterone. These actually increases the insulin resistance. So that gestational diabetes mellitus is very, very common in obese ladies nowadays. Now, who gets diabetes? Okay, the people who are more than 40 years of age, the people who are every day sitting at one place, not moving around. If you see 45 minutes and more than that television, again, it increases the chances of diabetes 16 times. If your weight is more, BMI more than 30, and if you're familist. So many patients tell us that I don't have Khandan history of diabetes, but it does not mean that your daddy should have diabetes to get you diabetic. Okay. So 50% patients nowadays gets diabetes in a family members, but 50% patient without family history also. If they are obese, they are not doing physical activity, they get diabetic. So it is not like that diabetes is a contagious disease. Diabetes is a metabolic disorder. It is because of physical inactivity, less amount of sleep, and many, many more things actually. Now, how will you know about like you are diabetic now? So when your blood sugar goes up, as I told you that fasting blood glucose is less than 100, postprandial blood glucose is less than 140. And now if you are becoming diabetic, so basically your sugar is going up, the glucose is going up inside your blood. So what will happen? The body will try to throw out the glucose in the urine. So you will have an artificial, like the glucose is going inside the urine. So you will have a glucose urea. Now, whenever glucose is going out of the body, it takes water also. So these patients actually go more times to the toilet for passing urine in the night, which we call actually polyuria. When the urination is increases more than 3 liters in 24 hours. Now, whenever somebody is passing more amount of urine, then your thirst center basically gets ignites and you drink more water. So these guys actually drinks more water. They throw out more urination. And then because of the catabolic state, probably they lose a lot of weight. So they can lose 5 kgs to 10 kgs of weight. And somehow the catabolism actually increases the breakdown of the muscles. So you get thinness. The muscle becomes very, very thin. And sometimes the lens, which is there in your eyes, actually, they get blurred. So the blurring of vision, non-healing of wound, giddiness, weakness, these all types of symptoms actually can get to you. And if you are getting this symptom, you should check your diabetes immediately. But whether these all symptoms which I explained you, they are all symptoms are necessary for diagnosis? No. Basically, only 30% of the patients really gets this symptom. 70% patients doesn't get any symptom. And they go to doctor for some reason, for say cataract operation, for some operation. And they tell us to do pre-operative checkup. And many of them actually detected asymptomatically diabetic. And these guys sent to us again for control of diabetes. Many of patient goes to dermatologist for itching at the genital area, itching, white discharges in the females, and fungal infections at private areas. So these guys goes to gynecologist or dermatologist, but main reason actually for that was high sugar. So patient can have one symptom or sometimes they doesn't have any symptom. So if you don't have symptom, whether we should treat it? Yes, we have to treat it. If you don't treat, even though you are asymptomatic, you don't have any problem. Many of my patients tell me that my fasting sugar is 200, I have postprandial sugar is 350, but I don't have any symptom. So why should I treat? But the necessity of treatment is basically diabetes is not the disease of numbers. It is the disease of the blood vessels. Basically, there are two types of blood vessels are there, which are called as macrovasculature and microvasculature, depending upon the size. And in that blood vessel, you start getting cholesterol deposition, you get blocking of the blood vessel, and you start getting problems from the head to toe, like from say in the brain, the blood vessel gets blocked, you can get paralysis attack. In eyes, on the retina, the small blood vessel gets blocked, then you get blindness. If you just come down in the heart, the majority of the blood vessels gets blocked in the heart and you can get heart attack. Then if you go down again, kidneys are also again is one of the important factor for kidney failure because of diabetes. And then in the foot, so in the foot you can get initially tingling, numbness, and then somehow you can get diabetic foot ulcers and then the foot amputation also. So diabetes is basically a asymptomatic disease, but it is very, very deadly disease. Once you get the complication, there is no way back to go to normal. So it is always essential for all of us to control diabetes to a target level, which we call as fasting blood glucose till 120, postprandial till 180, HbA1c till 7%. So these three readings are very, very important for diabetic patients. So after the basic knowledge about diabetes, I'll just talk about some issues in diabetes management, because these are a lot of questions when I think we have 22,000 patient database in our clinic now for diabetic patients since 2011. And many of patients actually ask multiple questions to me. And these questions I have just targeted and made together for you to just answer that one by one. So there are a lot of issues actually, questions and issues are there in the patient's life. So issue number one, whether my diabetes will disappear or cure. Many of patient feels like if I am getting diabetes, so whether it is curable disease or whether controllable disease, it is a controllable disease. You cannot cure it. But nowadays you must be seeing a lot of advertises in your mobile automatically voucher for diabetes reversal. They may ask you just pay 100 rupees and your diabetes can go away, something like that. But these are all bullshit. You should not trust on them. But still, diabetes reversal is a new era of research, and Dr. Roy Taylor from UK has done a fantastic work on that in 2016 onwards. And since that time, what he did actually, he tried to push these people energy deficient. Now, normally we eat 2,500 calories per day in an Indian diet. He made the population to eat only 800 calories. So he made the patient to eat less. He made the almost weight loss 10 to 15 kgs, and then he found out reversal. So it's very difficult in a general population to act. But many of our patients, like if you go on YouTube and write down my name and reversal of diabetes, I have 200 patients. We have reversed back their diabetes to normal. But these patients are not old. These patients are newly detected diabetic. Till 5 years, the reversal of diabetes or remission of diabetes, we call remission of diabetes, is possible. But after 5 years of duration of diabetes, the possibility is 20%. After 10 years, there is no possibility for the reversal, because almost your pancreas is getting disappeared. It is not functioning well. It is not producing any insulin. So the answer is no. Diabetes cannot be disappeared, cannot be cured. But if you are overweight, say your BMI is 40 kg, you are 100 kgs of weight, and if your target rate of like your weight according to your height, target weight is say 70 kg, and if you come to say 70 kg, from you lose 30 kg, then you can actually reverse your diabetes to a normal level. But possibility of reversing from weight of 100 to 30 is very, very difficult. So diabetes is not reversible. The reason behind that is, this is the figure which you are seeing. So this is the pancreas, which is basically a endocrine gland which produces insulin by the beta cells. And at the time of diagnosis, 70% of the pancreas is basically expired. So the 70% expired pancreas is not going to become normal, or probably it is not going to become normal to produce insulin. So what we do, we act on this remaining 30% of the pancreas. We put some medicines. We tell this 30% of the pancreas to overwork, and then probably insulin will come inside the body, and then probably your diabetes can come down. But this 30% pancreas, if you stop the medicine, this 30% pancreas is not going to work. So stopping medicine is not a good answer. The reason behind that, this is the UKPDS data, that is United Kingdom Diabetes Prospective Study. They just saw that at the time of diagnosis, how much percentage of pancreas is working, and they found out almost 50% of the pancreas is expired at the time of death of diagnosis of the diabetes. The first day you come to doctor with diabetes, numbers in your report, your 50 to 70% pancreas is dead. So we are not going to do anything. There is no research till now to improve that 70%. So we are just working on that remaining 30%. So basically, your bank balance is less now, 30%. So accordingly, you have to use that bank balance very seriously. So that's the reason we tell the patient to eat less amount of sugar directly, glucose and calorie restriction. Whatever we tell you to eat less glucose, good, sugar, whatever we tell you, don't eat juices and all. So do not stop anti-diabetic medicine if your doctor has started, and probably insulin also. If your doctor has started insulin, he is a good doctor for you. So don't resist the doctor who start insulin. The doctor who start insulin is an intelligent doctor. So don't stop insulin, because when the need of insulin is there, because 30% pancreas is going to just go degenerate every yearly, 2% to 5% per year. And over the period of time, say almost 7 years of duration of diabetes, after 7 years of duration of diabetes, you may require insulin according to your state of diabetes. So insulin is again one of the good medicine. And that's the reason 20 to 30% beta cells die, and we require basically insulin and medicines to be continued according to your doctor's advice. So now, next question is, can I stop my diabetes and cholesterol medicine? We talked about diabetes, so I told you that don't stop diabetes and insulin. And now cholesterol medicine, we'll come to cholesterol, because many of you must be having, say, cholesterol medicine in your prescription. And the answer is no, because whenever we tell you to start cholesterol medicine, you all people see the lipid profile report. Lipid profile contains almost 6 to 7 readings. Out of that, LDL cholesterol is very, very important. LDL is a bad cholesterol, and we should try to keep it less than 70 in diabetic population. And according to multiple guidelines, American Association of Clinical Endocrinology, American Diabetic Association, from India, RSSDI, these all guidelines tell us that without seeing the lipid profile report, you should continue this cholesterol lowering medicine if you are diabetic and if you are crossed 40 years of age. And they found out if your age is more than 40 years, if you are diabetic, the chances of dying because of heart attacks are 6 to 8 times for the people. So we don't give statins or the cholesterol lowering medicines to all of you for getting this number, for making happy the pathologist. No, not like that. I'm just giving one figure to you. So these are multiple factors basically which is there in the blood vessel. You are seeing that increased platelet function and coagulation and inflammation. We'll not go in detail of that, but there are 13 different pleiotropic benefits which we get actually because of this cholesterol medicine. And that's the reason we should not stop cholesterol medicine without asking doctor. At the same time, do not repeatedly test lipid profile report, see your report and try to stop the cholesterol medicine. No, you should not stop cholesterol medicine on your own also, unless and until it gives some side effect to you. Like cholesterol medicine generally cause body ache, myalgia, some side effect will be there. So don't see the numbers in the report. Basically, you should continue the cholesterol medicine if you are diabetic. Now, issue number 3, if you are diabetic and if your blood sugar is getting fluctuated, like say some people are on say insulin or medicine, and you started medicine, and after starting medicine, your say the sugar is going less, high, sometime it is 40, sometime it is 350. So what we should do? So basically, these guys actually, the patient should actually buy glucometer and try to actually test multiple times this glucometer. And why it actually fluctuates, there are 2 hormones which interplays for increasing blood sugar and reduction of the blood sugar. In a normal population, in the non-diabetic person, insulin is the hormone which is required for reduction of the glucose, and glucagon is the hormone which actually increases the glucose. So this interplay actually gets disturbed, and that's the reason your fluctuations of the blood sugar is very, very high. And that is the reason SMBG, it is called as self-monitoring of blood glucose, is very, very important. If you are diabetic and if you are experiencing 1 or 2 episodes of low sugar, you should buy glucometer. Try to keep it with you. Whenever you are moving anywhere in the world, you should keep that, because it will prevent the very much bad emergency in your life. At 3 o'clock in the night, if your sugar is going down, you are getting sweating, people try to hunt for blood pressure machine rather than testing the blood sugar. And I have seen a lot of people just checking the blood pressure and just passing the time for treatment. So if you know that blood sugar is less than 70, immediately you should start giving some sugars and all that. So who actually should have glucometer? The patients who are on insulin, type 1 diabetic, gestational diabetes, brittle diabetes patients on insulin, and the patients who actually gets repeated attacks of hypoglycemia. So in this population, what we do in our clinic, so if somebody is having say glucometer, still he is not actually working with that, so we have a continuous glucose monitoring system. Now this is a technology in the diabetes which you use. You are seeing the sensors are there which has been put on the arm, and these sensors we put in our clinic, and it tests every 15 minutes your blood sugar on its own. And in one day, see, test around 96 times. In 14 days, it checks blood sugar for almost 1392 times. It gives a good graph to me actually. At what time, what is happening to the glucose, what is the impact of high glucose, low glucose, insulin, whatever, a lot of interaction we can actually learn. And this is one of the good story I'll tell you. So this is the report which we see, CGMS report. This is a doctor's report, okay? This is one of the doctor's report who was gynecologist. His wife actually called me one day in the morning and she just asked me, Dr. Mahesh, we want to meet you. So I don't know what is the problem. So she just told me that my husband is just forgetting a lot of things now. So I asked like, why, what is the problem? So he had just paid 10,000 rupees yesterday and now he has forgotten today. So that means a big problem. So he was on insulin. As he was doctor, he thought he is treating himself very nicely. But because of insulin, he was not been in touch with any of the consultant like diabetologist or endocrinologist. So what used to happen whenever you are seeing, like if you are seeing from 8 o'clock in the morning, say 8 o'clock, in a whole day, his sugar used to be more than 200. And whenever he is testing, the sugar was more than 200. But in the night, it used to go to 40 and less than that. So repeated attacks of this low sugar in the night in the brain actually cause dementia and neurological dysfunction, and which has caused this forgetfulness. So this is actually the importance of the CGMS report, and we changed his insulin doses, insulin types, and then he became all right. So we should always understand, if you are diabetic, that what is meant by hypoglycemia. Hyperglycemia we all know, which we already talked about. High sugar, which is called as hyperglycemia. Low sugar is called as hypoglycemia. So whenever you are diabetic, you are taking insulin or any medicine for diabetes, low sugar actually can cause shaking, it can cause sweating, it can cause palpitations, hunger, headache, irritability, weakness, fatigue, impaired vision, fast beat. A lot of things can happen. If you are diabetic, anything happens to you, you immediately test the blood sugar rather than testing the blood glucose. And if you are awake, then you should eat immediately the blood sugar and immediately you report to your doctor that I am getting hypoglycemia, whether any need to change. So some of my patients actually gets up in the night at 3 o'clock, eats some 2-3 scoop of sugar, and they just again sleeps, but they don't tell us. So it is not good eating sugars in the night. You should reduce the insulin doses or the diabetes medicines. So for these patients, we actually, if the fluctuation is very much high, this is called as insulin pump therapy, which we call artificial pancreas, where the pancreas, this is actually pancreas, it injects the insulin as per our requirement. This is a program which we put. So this insulin pump therapy is very much good for type 1 diabetic patients, the brittle diabetes, very high sugar, low sugar, and this is artificial pancreas, which you are seeing on the screen. So issue number 4, whether diabetes and sleep has a good connection. You are seeing now here, say just above I have written cardiovascular diseases, that is heart attacks. Now, why heart attack really increases? Because of raised cholesterol. It is because of high blood pressure. It is because of diabetes, but it is because of sleep apnea also. Now, what is sleep apnea? Sleep apnea basically is a disease of snoring. So a lot of people actually snores. Now, why they snore basically? If you are seeing, there are 2 pictures again in front of you. One is normal breathing, on the other side obstructive sleep apnea. So these guys actually, when they actually snore, they take breaths. So the breath actually goes inside in the trachea, and because of the obesity, their flaccidness in the tracheal muscles, they get snoring. Now, snoring is not bad. 60% of Indian actually snores. It does not mean they all have this sleep apnea syndrome. But sleep apnea, basically, it is why this snoring, while snoring, they intermittently stops the breathing, because slowly and steadily your trachea gets slowly, steadily blocked. Once it gets blocked, you stop your taking breaths. So your wife, somebody is just sleeping beside you, she can understand. He was snoring and suddenly stopped the breathing. So that means the collapse of the airway actually caused blockage of the trachea. You are not taking the breath, so oxygen will come down. The carbon dioxide will go up, and suddenly your brain recognizes that and it gets up. So you will get like this, like sound, something like that. Again, you gets up, again, the same thing happens in a whole night. You don't get sleep. So these guys basically presents with multiple symptoms, like they get early morning headaches, they get daytime sleepiness. I have almost 150 patients which we diagnosed, and many of them had a driving accident. While driving, they slept. So in a whole day, if you are seeing in just sitting somewhere and just dozing up, okay, these guys actually are suffering from the sleep apnea syndrome, and it has to be treated well, because it is not the disease of sleep. It increases the stress hormones, which causes more heart attacks, more blood pressure, more diabetes. So they have poor concentration, irritability, they have falling asleep during routine activity. In the night, actually, there is intermittent witnesses in the stopping of the breaths, choking or like restless sleep, frequent visits to the bathroom intermittently, and loud persistent snoring. This is one of the disease, and this disease has to be taken care of. Now, how we know that these patients are having this obstructive sleep apnea? So this is a small test which we do in our clinic. This actually is the machine which we give to the patient in a whole night. They have to put this machine. Now this machine actually tests how many times you are snoring, how much your oxygen is reducing, how much carbon dioxide is going up, how much time you are stopping intermittently breathing, and this is the report which we get. And this person whose sleep study we did, so he was intermittently stopping his breaths 56 times in 1 hour. So imagine 56 times somebody is getting up in the sleep in a whole night. So he will not sleep in a whole night. His sleep is not there. So in the morning time, he's getting a lot of headache and all. So what we do, the treatment of this is basically CPAP machine, continuous positive airway pressure machine. So this machine we prescribe to the patient. The cost of this machine is 30 to 35,000, but it's wonder for his life. I have seen patients becoming diabetic to non-diabetic, hypertense to non-hypertense, obese to non-obese after treating this, because there are a lot of implications of sleep on the health is there. So these machines actually push the air in a positive way, so it doesn't allow the collapse of airway, and that's the reason snoring will go away, patient sleeps well, and that's the way it goes on. So now, after which comes to the diabetes, how should we take care of the foot? Foot is very, very important part in the life. Now when Sudama met actually Krishna, and that time immediately he tried to just he tried to saw his foot and taken care of his foot, because he was walking barefooted for a long time. So similarly, diabetic patients get two diseases, diabetic neuropathy and diabetic vasculopathy. Diabetes patients, in the limbs, nerves are the sensation which carry the sensation. The blood vessels are the blood carrying blood vessels. So the both things actually gets obstructed, and probably you can get this claw foot, weakness in the muscle. You can get the disfigurement in the foot, and these are actually causes dryness, because these patients always have loss of sweating in the foot, loss of hairs, these cracks, and these cracks allow entry of the bacteria, and they start getting these calluses, and these calluses basically cause ulcers and then amputations. So these are the tests we do in our clinic to just prevent these problems. Actually, diabetic neuropathy, this is in between tests we see ankle brachial index, where we see the blood, how the blood is moving from the heart to toes. Whether it is blocked, we can treat it, and many of the diseases we can do. And how we can treat, we should wear this MCR chappals, that is multicellular rubber chappals. You should not actually use this regular chappals, because it can slips from your foot and then it can cause a problem. So we remove the calluses. We tell the patient to observe the mirror with the mirror with their foot. Moisturizing agents and footwears are very, very important. So these are some ulcers which you are seeing on the screen. So these patients came to us, and we all treated these all patients before and after. You are seeing the pictures. So these calluses has to be removed, and these ulcers has to be treated. So if you are seeing this foot, so these foots are dry, they are disfigured, they are very, very, very much scaly, and this scaliness, dryness has to be treated well for the prevention of ulcers. Next issue, whether sexual dysfunction is connected with diabetes. Yes, the answer is yes. There are 3 types of sexual dysfunctions. Loss of libido, means sense of doing sex actually goes away. Premature ejaculation, not able to complete the sexual act. An erectile dysfunction, that is loss of erection. So these are the health benefits and of the sex. If you do regularly sex, you relieve the stress, you boost your immunity, burns calorie, improve cardiovascular health, boost your self-esteem, improve intimacy between wife and husband, they reduce pains, prostate cancer reduction, strengthen the pelvic floor, and many more benefits. So how sexual dysfunction has to be managed? The first and very important thing is exercise. If you do 1 hour exercise, probably your sexual life actually improves. You have to do the pelvic floor exercises also. If this exercises are not helping, you have to treat your diabetes, blood pressure well. There are some medication actually cause sexual dysfunction. You have to ask your doctor. Like there are some anti-blood pressure medicine, anti-diabetic medicines, some anti-heart medicine, they can cause erectile dysfunction. So you can talk to your doctor. If you are smoking, you should stop smoking, and there are some drugs which actually we prescribe for sexual dysfunction. And in aged people, after 40-60 years of age, probably they can have a late onset hypogonadism, that is the testosterone hormone production actually goes down, So we diagnose this, and then this testosterone can be supplemented. And some of the people actually are prescribed this vacuum assisted erection devices also, 2 of my patients, and they are doing well on that. So this is all about diabetes and multiple facets of diabetes which people actually live. Now we'll just talk 2 slides for blood pressure. Now what is mean by blood pressure? The blood pressure is pressure which is created on the blood vessel. So your blood vessel is very much elastic when you born. Now as you grow, your blood vessel become very thick, and that's the reason the pressure which has been exerted by the blood, which is called as high blood pressure, and normal blood pressure is 120/80. If you are more than 140/90, you should treat it. If you don't treat, you can get again stroke, vision loss, heart attack, kidney disease, heart failure, and sexual dysfunction because of high blood pressure. So treating blood pressure along with diabetes is also very, very important. Now what is mean by heart attack? What happens with the heart attack? This is the heart, and these are the blood vessels which are called as coronary arteries. The blood vessels which supplies the blood to the heart are called as coronary arteries, and these coronary arteries get suddenly blocked. And after blocking this artery, the further portion of the heart doesn't get the blood, the oxygen supply, the glucose supply, and the heart muscle actually dies. Now, how will you diagnose it? Many of the time, you should actually recognize the chest pain. Now, I am not explaining purposefully how the chest pain happens in heart attack, because many of patients, if you listen to that, again, they feel I am getting heart attack, something like that. So just understand, if you get chest pain, you don't think almost every time that it is because of acidity. It cannot be because of acidity. Go nearby doctor, do at least ECG. There is one test is called as TROP-T test. TROP-T test. Now TROP-T test is what? It is a troponin, the chemical which secreted in the blood after getting heart attack. So this TROP-T test, if it is positive, then we tell the patient to go to the doctor, do the angiography. Now what is mean by angiography? In angiography, we put the wire, not me actually, cardiologist, put the wire inside the heart, and they push the dye, and after pushing the dye in the coronary blood vessel, he sees the normal anatomy of the blood vessel. Now if he sees the block, then what it does, he actually do the angioplasty. Now what is mean by angioplasty? This is the blood vessel which you are seeing. He put the wire, and on that wire your spring like action is there, and then he just opens the artery. So if you just treat this heart attack within 6 hours, then your heart becomes absolutely normal like previous. If you wait for a long time, the dead tissue of the heart will die, and after 24 hours, many of the heart tissue will not work. After 24 hours to 48 hours, even though you do angioplasty or bypass surgery, the helping from this management will not be good. So this is the last slide. If you are diabetic hypertensive, you should target your goals. So I always tell my patient, treat diabetes to target level and live longer. Treat diabetes to target level and live longer. So what are the targets? Fasting blood glucose should be in between 70 to 130. If it is less than 70, you tell your doctor. Postprandial sugar, that is after food sugar, should be less than 180. HbA1c should be less than 7. Total cholesterol should be less than 150. Triglyceride should be less than 150. LDL cholesterol, which is called as bad cholesterol, should be less than 100. Blood pressure should be less than 130/85. Body mass index 22 to 25. So you reduce the body weight. So I am just giving one video for my clinic. If it is possible, I don't know whether voice will be clear. So I'll just play it. I think it is 3 or 4 minutes. So just observe on your screen. This is my clinic, I think you are seeing the video now, right? Are you seeing the videos? Yes, good. So this is a clinic which is situated just opposite to Grand Center Mall.
Video start.
So thank you so much for patience listening. I think I can stop my sharing, and then if you have any questions, then we can take. Thank you so much, sir.
Sir, you have told us this HbA1c test.
Yeah.
Whether this test is better or fasting or after eating that test is it?
We stopped doing fasting PP since 7-8 years. Now we don't do fasting PP to any of my patients. We just tell them to do random blood glucose, which tells you what is the blood sugar levels today and HbA1c for last 3 months average. So the guideline tell us to just do HbA1c and change the medications. Fasting PP is just outcome of one day. So, and whatever the complications of diabetes are there, they are not actually tested on fasting PP. They are just correlated with the HbA1c. If you keep HbA1c lesser than 7, then your chance of getting diabetes complications like heart attack, paralysis attack are lesser than other populations. So we don't do fasting PP in our clinic. I don't advise probably.
So it is better HbA1c.
Yes, 3 monthly
Test is
HbA1c should be tested.
Okay, thank you.
Hello. Doctor, what is your take on that plant which we get and we eat? Insulin plant or some leaves?
Leaves? Oh,
Yeah.
actually, I'm not Ayurvedic doctor, but many of my patients actually eat some plants and a lot of like jambul beach powder. There are a lot of things they eat. So I advise them that I don't have knowledge about it, but if you get a good result, you can continue. If you get side effect, you stop it.
Thank you.
Doctor, Emanand Saxena,
Yes, sir.
glucometer we are using at home, and when we test sugar level, so at the same time, if we do twice, there is a difference of 20 or 25 units.
Yes.
So whether we should start the first drop after pricking it, or what is the actual procedure actually?
No. So basically, blood sugar actually changes every second. It depends upon multiple factors. So if you do now and after 5 minutes, it changes. The one thing which you have just raised the question about glucometer use and its reading, many of patients, when they come to our clinic, they just talk to our lab people. At home, I tested it is 90. In your clinic, it is 110. So why it is? Because we take the capillary blood when you test the blood glucose, and in the lab we take venous blood. So the difference, there are two different bloods we are testing. There are two different methods we are testing. So you don't worry about the numbers, whether it is lesser or more, but it will definitely tell you whether it is 100 or 500, whether it is 40 or 400. So don't worry about 120 or 140, doesn't matter. But this variation is lesser in fasting state. This variation is more, almost 20% when you do the blood test after food, postprandially.
Good
Thank you,
evening, doctor.
doctor.
Good evening, doctor. This is Lakshmi Patro.
Yes.
I have a question. What does it indicate if the PP level is lower than the fasting level?
Now, if you are pre-diabetic, see if you are, whether this is about yourself, you are asking, Patro?
Yes.
Yes. Okay.
HbA1c is always less than 6.
Yeah.
But most of the times the PP is lesser than the fasting.
You must have asked your doctor previously. What was his answer? You can tell me.
My doctor says that it's not diabetes, but you need to take care and you have to keep testing regularly.
But what was the reason that postprandially sugar is less and fasting is high?
He didn't explain to me about that.
I'll tell you. Basically, diabetes is a continuum. Okay. So if you are getting diabetic, say some next 1 year, so what happens? Your body is in an insulin resistance. Now your insulin resistance, the body is producing more insulin. Okay. So just consider, if I am non-diabetic, I eat 1 laddu, you also eat 1 laddu, and we tested both of our insulin level. Your insulin level is 4 to 5 times more than me, because your body is trying to make you non-diabetic. Body knows you are going to get diabetes in the future, but body actually wrongly producing more insulin, and you are getting big problem because of that. You eat more. If you don't eat, at times you get shivering, you get weakness, right?
Right.
Yes, this is called as postprandial hypoglycemias, reactive hypoglycemias. you eat. If you don't eat at time, you get shivering, you get low sugars, and you are just worrying about it. So stop sugar eating, the problem will be solved. So basically, abnormal secretion of insulin in a pre-diabetic population is the cause of low sugar after food and high sugar in the fasting.
Okay.
There is a conception, doctor.
Yes.
There is, because I met a very senior doctor
Yes.
in Kerala, and he was telling me that the side effects which is happening for diabetes is because of the drugs, as an anti-diabetic what you take, and not because of diabetes as such. He says the retinopathy or loss of blood in the legs, all these are caused by anti-diabetic tablets or insulin. And he says it's not because of diabetes.
Because he was a senior doctor.
Yeah,
He was senior doctor. That is the reason. Because when he actually learned the medical science, that time medicines were not available. Okay. So he doesn't have experience about medicine. He should not talk about the medicines. Because he doesn't have actually the knowledge how we use, what is the new research. Because before 1980, only 2 drugs were available. One is glibenclamide and another drug was metformin. And these guys only treating with 2 tablets. Okay. And these both 2 tablets nowadays we are not using in a elderly population. So there are now very much new medications has come. So now there are new medications. Not only they are reducing the blood sugar, they are reducing your heart attack. They're reducing your cardiovascular deaths, heart attack, deaths, heart failure, lot of things. They're reducing cancers, they're reducing non-alcoholic steatohepatitis, that is fatty liver disease, many problems in one pill. One pill is causing low blood sugar, low blood pressure, low heart attack, low deaths, everything is there. And this is in the research. Okay. So it is not personal opinion we should consider. Okay. We should always understand and actually oblige to the research, updated research till now, what is happening in the world. Okay, so I am not just taking some wrong words to your doctor, but the thought process should be that you should treat diabetes. Even your doctor gets diabetes, 100% I am telling you, he will go to a good endocrinologist and he will treat himself. Okay, it's very easy to talk to the people. Don't do like this, don't take tablets and all, but it is not easy for himself.
Can I ask one question?
One more last question, sir.
Yes.
Is Jawari roti and rice curry, red rice, better than ordinary rice and chapati?
Yes, no problem. You can eat. See, I'll tell you, rice is as equal as chapati. Okay, when you eat in a good portion, because if I have a lot of patients, like Navi Mumbai is cosmopolitan. If some Kerala patient comes to me and I tell him, you got diabetes now, you stop eating idlis from tomorrow. He will tell me, I will not come to you from next day. Okay. So all foods are good. Now I tell him to just eat this idli, but you modify idli. You put some sprouts in that while you cook. You eat idli with the sprouts. So something like that, you can eat rice also in diabetic population, but you reduce 50% portion of the rice, whatever you were eating previously, and you put a lot of dal and sabji, vegetables, while you are eating the rice. So basically, 1 ball of rice is equal to 1 chapati as compared to energy, carbohydrate content. Okay. But rice and chapati, what is the difference? Rice is having high glycemic index. What is mean by glycemic index? When you eat anything and if immediately it is sugar is spiking, this is called as high glycemic food. So your body will get very less time to produce insulin. Low glycemic food you eat, sugar is going slowly upscaling in your blood. So your body gets good time to produce good amount of insulin. Okay. So you can eat anything, but in a good portion with adding something, like you can add fruits, vegetables, sprouts when you eat.
Doctor, sometimes
Thank you very much, sir. Thank you very much. And I would like to come and see you one of these days, sir. Thank you very much.
No problem. Thank you, Pushpa.
Thanks, sir.
Yes, Agrawal, sir. No problem.
When they are doing the blood test, they ask you to come after breakfast 2 hours.
Yeah.
But sometimes they say you take your full lunch at 12 o'clock and then come after that. So what is the difference between these two?
So basically, I just kept that slide. I'll tell you, there is something is called a Dr. Lee Monier from Italy. He just did the research on that, whether after breakfast, after lunch, and after dinner sugar, which sugar should be tested. And he found out that always after blood sugar, after breakfast sugar is always higher than after lunch and after dinner. So if your after breakfast sugar is controlled, that means indirectly it is telling you after lunch and after dinner is controlled. So don't talk to the lab person. You just go after breakfast only. Don't take your lunch and do it, because it will be wrongly, it will come reading low. Okay, so always after breakfast sugar is higher than after lunch and after dinner.
And one more question. I heard recently a talk by a doctor researcher saying that eating mangoes does not add sugar to the blood because the whole of sugar is in fructose form, which does not get into the blood. And that's why you can take mangoes, but in a limited quantity.
This is very burning topic now today. Okay, so if diabetics are there, they are just eager to listen to me. ना आज डॉक्टर ने बोला खाने को तो आज शाम से चालू कर देंगे. So basically you have to understand the biochemistry. Now glucose and fructose, these are the two different sugars. Okay, if you see the carbohydrate is a one bigger entity. In carbohydrate you have a polysaccharide, oligosaccharide, monosaccharides, and these monosaccharides are glucose, fructose. These are the two different sugar. The sugar which we eat from rice, chapati, direct sugar, it is a glucose. Now, whichever the sugar which eat from the fruit, it is actually fructose. Okay. Now, this mango you can eat even though you are diabetic if your HbA1c is less than 7. Okay. If your HbA1c is more than 7, you should not eat. Why? Now, if your HbA1c is more than 7, so it is considered that your insulin level is less. Now, if your body is having low amount of insulin, your fructose is easily gets converted to glucose. So even you are diabetic, and if you are uncontrolled diabetes, then you should not eat mangoes. If you are diabetic and if your HbA1c is 7 and less than that, you can eat 1 mango per day from my side. And this is the science behind it. So controlled diabetes will have a good amount of insulin. So the main message from this, Mr. Patro is laughing actually. Now from today, you should understand control diabetes first and then start eating mangoes. Okay. So first see your HbA1c. If it is less than 7, you can eat 1 mango and you can tell anybody, you can just record it. Okay. So this is the scientific answer for mango and diabetes.
What about other fruits?
All fruits, all fruits. So we have a fruit actually, list of the fruits. I'll just name the fruits. Many fruits you can eat. Even though you are diabetic, you can eat a lot of fruits like guava, you can eat papaya. Okay, 1 minute. जरा ते फूड्स लिस्ट घ्यायला सांग ना. फूड हां दुसरा बोलो कोणाचा. Okay, I'll just tell you the names of the fruit which you can eat. Okay, there are some fruits. Low glycemic fruit you should eat. High glycemic fruit you should not eat. Something like that. It is very simple. The fruits like chiku you should not eat. Okay, the fruits like are diet sheet de na. I'll just read the names so you will understand. अरे कोणतं तर फाईल दे ना डायरेक्ट. फाईल दे ना राजा. So when you come to our clinic, actually we give the signals actually, red signal, yellow signal and green signal. Okay, yellow signal you should, the red signal you should stop eating. Green signal you can eat and yellow sometimes. Okay, so I'll just read the fruits name which are there in the green. So you can eat sep, santra, mosambi, peru, amrud, anar, papaya, jamun, nashpati, strawberry, kharbuz, adu. So these are the fruits which are good for diabetic patients. Now which fruits we should not eat? Kela, aam, angur, chiku, sitafal, ananas, tarboos, lychee. So these are the fruits you should not eat. So you just see like which fruit you like and which, whether it comes in green category or red category. So these categories we have actually done good amount of research and we have just made this actually for the patients. Okay. Yes.
Okay. Doctor, I am Prakash here.
Yes, Prakash.
I am, my readings are now latest reading fasting 110 and PP 190 and HbA1c 6.5. I am taking a tenali mark.
Continue, sir. Continue, sir.
Yeah.
Continue, sir.
Temalimac,
Sir, this is personal question, sir. Don't ask because other people will not be benefited or because of your answer.
okay.
You should ask the question which will benefit to other guys also.
Yeah.
So otherwise, these people will feel that doctor is spending my time.
Got it. So,
Sir, doctor,
yeah,
doctor,
I take
some doctors suggest that blood sugar test should be taken 1.5 hours after breakfast.
Actually, scientifically 1.5 hours is correct. Scientifically 1.5 hours is correct. But nowadays, since long years, this is probably you can think the culture which we have developed over the period of time, that is 2 hours. So you can go in between 1.5 hours to 2 hours. That is the best thing.
Thank you.
Okay.
Doctor, how about honey?
Continue my question. Actually, I am taking diabetic medicine, but at around 10 o'clock before breakfast and after breakfast. But 1 o'clock before lunch, if the lunch is delayed, now there is some trembling I feel.
So you are getting hypoglycemia, Prakashji. You are getting hypoglycemia. Your medicine has to be changed.
Okay.
You are
Doctor,
getting
how
low
about
sugar.
honey?
Huh?
Okay.
How about honey?
Honey you can take, but not too much actually. 1 or 2 teaspoons at the most. Don't take like in the kheer and all. Don't prepare kheer with that.
Okay.
Yes.
Dr. Steve Sharma here.
Yes, sir.
Doctor, I just wanted to check. In fact, today, in the market, we have different brands of glucometers available.
Yeah.
Suggest and advise some technical parameter, maybe 1, 2 or so, which we should specifically check when we are buying a glucometer.
See, basically all glucometers work with the electrochemical technology. I'll tell you what happens when you use the glucometer. When you put the strip, the blip will come that put drop in the strip. On the strip, there is one enzyme is attached that is called as glucose oxidase, God and pod, that is glucose oxidase enzyme. Now, when the glucose oxidase come in contact with this strip, the blood which comes in the contact with that, it gets converted to this peroxidase enzyme, peroxidase. And in that peroxidase is converted to hydrogen ions. And these hydrogen ions, how much hydrogen ions are there, that is being electrically readed by this glucometer. So all glucometers are having the same technology. Okay, number one. Now, if you are very much affordable and if you don't have any problem, so you can opt for One Touch from Johnson & Johnson or AccuCheck Ultra from AccuCheck company basically. So these are the two reputed brands and their strips are available. Now, if you want to say you can, if your requirement is very much high, if you have to test much more time, if you are on insulin, so testing with strip of 22 rupees is very costly. So there are a lot of glucometers which has come in the market now. They cost 500 to 1000 rupees, and strip also nowadays are cheaper, 10 rupees per strips. In our clinic, these glucometers, we have 2 types of glucometer. If patients are not so much affordable, then we tell them to buy the lower version, but that's fine. The reading doesn't matter too much actually. What is important to understand that the strips which we buy, they only work for 6 months. So we have to understand the strip should have a dry environment. If you open and keep the strips open for a long time, the strips actually can have a wrong readings. And very importantly, many of the time when you prick your finger, the prick should be very good. So you should not do like this. Okay. And when you are doing like this for removing the blood from the prick, then the readings will be wrong. The prick will be good. So immediately the blood drop will come and immediately you can touch to the strip. That's the way it works. So all glucometers are good. They work with the similar technology.
Thank you, sir. Thank you so much.
Sir, this is Ramani Murthy. I just wanted to know, what if we just have a diet control and not eat medicines? Will it affect?
Yeah, I already answered this question, whether diabetes is reversible or not. It is reversible if your duration of diabetes is lesser than 5 years. You can just go on YouTube and listen to my YouTube video, Dr. Mahesh Padsalge, Reversal of Diabetes. You can put in the YouTube, you can see that video, how it works. We have a plan for 3 months for these patients who are less than 5 years of duration, and the people who are very much committed. We don't promote this from my clinic. If people comes to me for that purpose, then we tell them we have a facility, because the commitment is very important. Okay, if you learn to eat less, then probably your diabetes can go away. So that's the reason I was telling you, if your weight is 100, if you reduce 10 to 15% of weight, So if you come to 85 from the 100% your diabetes will go away. It will be get cured. But you have to maintain at 85, which is very difficult nowadays in a environment of good amount of full amount of fridge filled with multiple food varieties. When you just open the fridge and something is prompting to you, something like that.
Doctor, how does the intermittent fast help?
Intermittent fasting, actually the concept really came from Dr. Dixit. Many of you know about Dixit. Dr. Dixit is from my place, Latur district, and he is not actually MD medicine, or he doesn't know about the science knowledge. Actually, he's a preventive medicine guy, but he tried to learn something and he just promoted very nicely, and I also promote him. Now, intermittent fasting means you eat only 2 times. So mentally he is giving a good block to your mind. You have to eat only 2 times. You cannot eat. You cannot open your mouth for 3rd time or 4th time. Now, whatever the people around you who are obese, they are not obese because of the eating their meal. They are obese because of intermittently they are eating something else. They are eating chocolates. They are eating some sweets around. They are eating samosa. They are eating something else, chips. So what he did, he just made your mouth shut up with the mental block. Nothing else he has done. You can try in your life. You eat only 2 times. Don't drink tea. Nothing. Only 2 times you eat, your weight will 100% reduce. Because there is a portion. That portion only you can eat. Much more portion you cannot eat. But again, what I have felt in my last some years after Dikshit, that only 1% population actually continues to have that intermittent fasting. So if you can do it, it is best. If you cannot do, just don't worry about it.
Okay,
Doctor,
yes.
Doctor, whether physical strain and mental stress continuous, will it affect our sugar content? Because
Yes,
in pandemic time, lot of persons they became diabetic.
Yeah, no. In pandemic time, lot of people not became diabetic. Once they either got vaccination, post-vaccination, or post-COVID, they became unmasked. We call unmasking effect of the diabetes. They probably were pre-diabetic, and because of the hit of the COVID virus to their body, the inflammation in the body goes up. The inflammatory counter-regulatory pathway, which includes glucagon, growth hormone, corticosteroid, adrenaline, these are hormones actually increased, and they made you diabetic. So I am seeing a lot of new patients, whether they are young or old. A lot of people became diabetic in last 6 months, probably 1 year. Every day I see 5 patients newly detected diabetic, and many of them are post-COVID or either post-vaccination.
And mental stress and mental strain.
Yeah, mental stress. See, mental stress, probably if you don't sleep well, if you are mental stress, probably your counters you can stress hormones increases in your body. The steroid hormones increases. Whichever the stress you are facing, your body will produce steroid hormones against that, and the steroid hormones are pro-diabetogenic. That's the reason they become diabetic. And many of people actually, they were habit of walking for at least 1 hour. They just sat at home. They were seeing the television and seeing how many COVID patients died every day. And again, they become more stressed and they become diabetic. So the physical inactivity also played a big role in that.
Thank you, Doctor. Thank you,
Dr. Mahesh. I think we will take one more question if there is any. Otherwise,
yes, sir. Thank you, sir.
Any last question? Okay, if there is no last question, Dr. Mahesh, I think it was a wonderful, wonderful
yes, sir.
question.
Yes, I have a question.
Yes, Chandrakant, you can ask question.
सर, ये पॉसिबल है क्या, ये जैसे हम लोग एंटी ग्रेविटी एक्सरसाइज करते हैं या डाइट कंट्रोल करते हैं, या पर्टिकुलर आप जैसे बोले हैं, जैसे एक चपाती खाएगा तो एक उसके साथ दाल और सब्जी, इससे डायबिटीज कंट्रोल हो सकता है क्या?
हो सकता है, हो सकता है. एंटी ग्रेविटी मतलब ऊपर चढ़ना. ओके,
यस. हाँ,
आप शायद पुणे का जो डॉक्टर है हमारा दोस्त, उसका कुछ शायद आपने अटेंड किया है ग्रुप मीटिंग वगैरह, बराबर?
यस.
व्हाट इज हिज नेम? यू कैन टेल एवरीबॉडी हिज नेम.
नहीं, मैं दूसरे जगह से किया, उनका नहीं किया.
दूसरे जगह से किया. बेसिकली कॉन्सेप्ट इज दिस.
एंटी डायबिटिक एक्सरसाइज मैं करता हूं, इसी वजह से पूछ रहा हूं.
नहीं, बताता हूँ. एंटी ग्रेविटी एक्सरसाइज बहुत अच्छा है. यदि आप एंटी ग्रेविटी कर सकते हो तो ओके. आपका हार्ट यदि अच्छा है तो एंटी ग्रेविटी करना बहुत जरूरी है और अच्छा है. मैं खुद हर दिन एंटी ग्रेविटी एक्सरसाइज करता हूँ. मैं अपोलो हॉस्पिटल पे गाड़ी रुकाता हूँ मेरा सुबह, और ऊपर चढ़ता हूँ, ऊपर से नीचे उतरता हूँ बेलापुर से वापस आ जाता हूँ. तो 2 जगह पे एंटी ग्रेविटी होता है. जब तक वो मैं करता नहीं हूँ तब तक मुझे नहीं लगता कि मैंने एक्सरसाइज की. अभी मैं प्लेन रोड पे वॉक करता हूँ तो मुझे लगता है कुछ नहीं हुआ आज, something like that. So anti-gravity, because when you walk, your heart actually beats more faster. And whenever your heart is beating more faster, your metabolic rate increases. Your fat is getting burnt out. So when you start walking, initially the stored glucose, which is called as glycogen, is actually burnt from the muscle. After some time, again you are just walking, that glucagon has finished, then it takes fat. So fat is converted to energy if you just go anti-gravity or if you walk more than 45 minutes per day. And that fat burning is very important for reduction of insulin resistance. That's the reason anti-gravity walking is good. If you can do, it's best. So you can all go to anti-gravity walking whenever possible.
Okay, Dr. Mahesh, thanks a lot. I think it was a wonderful, wonderful session. We look forward to your sessions in future also. We are indeed grateful to Ashwini Darekar, Madam, our member also, for getting your contacts and getting us over here. Thank you. Thank you very much, sir.
Thank you so much.
Thank you, doctor. Thank you, doctor.
Thank you, doctor. Thank you.
Very
Thank you,
helpful
doctor.
session.
Thank you, Ashwini Darekar, Madam.